the female athlete, sports nutrition. So REDS or REDS, okay, the full form of REDS is relative energy deficient in sport, not just for female but also for males. Okay, so what is it? Energy deficiency means what? You're not having enough food. Food is the one main source that is going to fuel you. It's going to give you energy. Okay, so you cut down your calories, you don't eat enough food based on your performance requirements. Okay, your caloric needs are not met. Okay, so that leads to this condition called relative energy deficiency. Okay, am I audible? Am I still audible? Okay. So this is relative energy deficiency in sport. Okay. So what is it? It is a condition of energy deficiency caused by adverse effect on all bodily system. In males and females, it has different repercussions, but here we will specifically speak about female athletes. Okay, specifically dancers or any sports or any performance medium like gymnast and all, where your body image is of a concern. Okay, you have to take care of your body image, how you look, your grades, your elegance, your weight management. Okay, when these categories come into your performance, there are high chances that you may go into this relative energy deficiency in sport. Okay, so why does it matter? Because if you are a teenager, okay, if you're dealing with a teenager, see, teenagers from their childhood, they will be enrolled into ballets, okay, ballet performances, any dance performances, sports or gymnasium, etc. It starts from childhood. Okay, and from that small from that little mindset itself, if it is fixed that if they have too much of food, they may put on weight and they may not look good on stage. Their performance will be inhibited because of their weight. So they will cut short their food, and growing kids, growing teenagers, they require energy. Okay, they require their caloric requirements. Okay, and it impairs if they do not get enough calories. If they do not get enough nutrients from their diet, it can impair their growth and development. After you turn into an adult, performing adult, okay, what happens? Your health and well-being will be affected. Okay, if your calories are not met. Okay, calorie requirement is not met, then it adversely affects your performance. If your calorie requirements are not met, your body uses up the existing muscle tissues, whatever the body can use up from itself, it will be using it up, and you are more prone to injuries. Okay, and it will also affect your performance. Okay, so this is the reason why REDS is important. We have to check on these factors as well. Okay, how to check and what you have to note in females and males, we'll see that later. For female athletes, are they having their regular menstrual cycle? Okay, 28 to 35 or 45 days. Okay, even if it is if a woman is getting her menstrual period, it is delayed by 45 days and all, it's fine. Okay, it is considered healthy in today's world. Okay, so regular menstrual cycle is there or not, that's a main parameter to check their hormonal health. Because if the menstruation is not normal, something is misplaced, some hormones are misplaced, and that could lead to other aggravated situations. Okay, and if you're dealing with a teenager, growing teenager, if the child has not received have not attained menarche, okay, the first period menarche, by the age of 16 they have not started their periods, it requires medical investigation. Okay, and if somebody is on oral contraceptive pills for birth control reasons, or even to control PCODs, PCOS, etc. Okay, that they are also at the risk. Okay, people who are in oral contraceptives, they are also at the risk because estrogen would be depleted here. Okay, so whenever an athlete is under oral contraceptive pill, they have to inform their coaches, they have to inform their nutritionist. Okay, so what puts athletes at risk of developing eating disorders? Okay, it's specific for sports only. So aesthetic sports, as I mentioned earlier, where you a lot of focus is on the appearance, the grace, the body movement, okay, the body structure built. Okay, so lot of focus is there on the athlete's appearance while performing. For example, in gymnast, skating, swimming, dancers, ballets, etc. Okay, and they have a very revealing uniform. If you have noticed the costumes what they put, okay, all the body contours are very much visible through their through what they wear. Okay, so in such sports and all, they are very concerned about any extra flab or extra any extra love handles, etc., which is there on their body. They're very much concerned, and they think that if they cut short their foot, they can get back in shape. Okay, sports that focus on individual versus the team. In if it's a team sports, team based sports, you are not that much worried. But if the entire focus is on you, for example, gymnastic, skaters, dancers, etc. Okay, then endurance sports like running, swimming, and zero gravity sports like skydiving, sky jumping, jogging. Okay, these are the athletes who are at risk. Okay, wrestlers and boxers are also at risk because they want to get into a they will initially try to reduce their weight to come into a smaller weight category, to compete in a smaller weight category, and then they will try to increase their weight, so they are also at a risk. Then other risk factors apart from sports, okay, apart from this specific appearance based sports, what are the other risk factors that put people under reds risk? So personality traits like perfectionism or competitiveness, and that is a psychological factor. Okay, perfectionist. Okay, identity based on heavily on participation in sport, that I have to participate. If I don't participate, my body image will not be good, my public image won't be good. Okay, and overvalued belief that weighing less will make you better in sport. Okay, if I weigh less, if I'm lightweight, I will automatically perform better in sport. Okay, social or team influence about the sport and eating behaviors. If you see your teammates having a specific kind of restrictions in their diet, okay, so far you have never had such restrictions in your sports journey, but when you try and meet more people, when you try to network with more people, and you see the others are doing certain kind of restrictive diets, some keto diets, some new fat diets. Okay, and you also give into the peer pressure. Okay, you also give into the peer pressure, so that could also lead to these concerns. Coaches who focus solely on the performance and success rather than the person. Okay, the coach wants the performance, the coach doesn't want doesn't care about your health, your mental health, and well-being. They just want the trophies. Okay, such kind of coaches and people who are being coached or mentored by such uh, people, such coaches are also at the risk of getting such eating disorders. And family history of eating disorders or other mental health conditions can also lead to menstrual dysfunction. So all the elite athletes who are well known, for example, Roger Federer, okay, Serena Williams, Venus Williams, these are the people who are elite. We consider them elite athletes. They are very well known. Virat Kohli, Sachin Tendulkar, okay, these people are well known for their in their arena. Okay, so most of the 13.5% of elite athletes have some subclinical eating disorder symptoms. Okay, and if you check, if you follow any sports magazines closely, okay, if you have subscribed to some sports magazines, every month or every week you may come across some or the other sports personalities opening up about their mental health disorders, their eating disorders. Okay, you will come across such articles very often. Okay, then athletes that are two times more likely than an average people to get eating disorders. If you compare an average individual, simple school going children, and you can compare those children to their peers who are into sports and athletic performances. Okay, children who are enrolled into such sports and athletic performance, they have a higher chance of developing eating disorders than the kids. Okay, and among all the eating disorders, 42% of female athletes who are competing in aesthetic sports, aesthetic, as I mentioned earlier, dancers, gymnasts, swimmers. Okay, they have known to be under this eating disorder category. 42% of them. That is almost half of the female athletes who are in aesthetic sports. So what are the warning signs of eating disorders specific to athletes? Any athlete who is very much concerned about their body image, even if they put half a pound or half a kilogram extra, 1 kilogram they have increased by their weight, they get very agitated, very frustrated about this. Okay, their heart rate is low, they have a low blood pressure. Okay, increased fatigue and perceived exertion. Okay, they think that they have even though if they are not that much tired, but their body responds like they are very much tired. Okay, decrease in performance, especially when combined with other warning signs, along with all these perceived exertion, low blood pressure, automatically decrease in performance will also tag along. And longer recovery times once they are, when the resting period is given to for the athletes to take a rest and then bounce back, the resting period is not enough for them. Okay, decreased coordination if it's a team sports, or even if it is on a tune or a music, they have to do some coordinated movement. They lose their focus from that because of concentration issues, and there are high chances of getting injuries and sprains, fractures, etc. Why do we get fractures and all? We'll see later how it affects. Low caloric diet affects the bone health of the female athlete. We'll come to that later. So withdrawal, apathy, moodiness, agitatability, the mood issues. Okay, difficulty with tapering or days off. They can't sit ideal. Okay, they want every day to be their workout day, so they can't taper their days of the workout. Okay, increase in workout, adding in runs or gym time outside the practice time. Even if it is their relaxing time, they don't have to work out, it's their off duty time, but still they will exert themselves the maximum. Okay, so these all are the signs and symptoms of some eating disorders. Usually if they're exerting themselves too much or even outside their practice or training time, it means high chances are there that the person is suffering from anorexia nervosa. Okay, we'll see that here. So anorexia nervosa and bulimia nervosa, it's the most common eating disorders which we see among the athletes. So anorexia mainly refers to starving oneself, okay, on purpose, to keep a skeletal-like body, no muscle, no fat, just bones. Okay, that kind of, to maintain that kind of body structure, people go into anorexia nervosa. Okay, bulimia nervosa refers to binge eating followed by purging. Okay, they eat a lot and then they will induce vomiting, or they may take laxative, okay, to get rid of whatever they have eaten. Okay, the person may look average. Okay, they may look completely normal, or they may look slightly overweight or obese, but they will not look skeletal. Okay, like how an anorexia nervosa patient looks, the bulimia nervosa patient will never look skeletal. They look average build, normal muscle tone and normal build, but they have this eating behavioral disorder. Okay, the patients are very thin in anorexia. Okay, emaciated most of the time, they have lost a lot of muscle mass. Okay, and in bulimia nervosa, they have an average weight ideal for their height, and in some cases they are overweight or obese. Then anorexia nervosa, they prefer to starve themselves or eat very less, and they have this mentality towards calorie counting. Okay, you give them any food, okay, just by looking at it or just by the name of that food, they can say how much calories will be there in that food. Okay, then patients eat heavy meals. This bulimia patients, they eat heavy meals followed by purging. They will eat a lot, but they will induce vomiting, or some other form of scenarios through which they can get rid of the food they have just now eaten. And it may result in medical condition, and anorexia nervosa may result in medical condition like amenorrhea, that is absence of menstruation, amenorrhea, osteoporosis, infertility. Because of amenorrhea, obviously, infertility will just come along. Then bulimia nervosa, it may result in heart failure and damage to esophagus and teeth. Why esophagus and teeth? Because constantly purging yourself, okay, constantly causing induced vomiting, there will be some wear and tear to the esophagus tissues, muscles, etc. So can the people who are suffering from eating disorder, athletes who are suffering from uh, eating disorder, can they continue their training? It's astonishing, but it's true. They can still continue training because they have built up their mind, that is their psychological factor as well as their physiological factors. Okay, these are the two factors which lead them to perform even if they are having some eating disorders. Okay, for example, psychological factor, they have made up their mind to be the sufferer. Okay, they are ready to suffer. uh, you push them how much ever they want to, how much ever they can, they will push themselves. Okay, they will suffer like anything, but they will still do the training. Even if they're starving, they will still do the training. That's their psychological factor. Okay, they want to push themselves to the extreme of exhaustion through suffering. Okay, so that's the psychological factor. Coming to the physiological factor, uh, slowly when you cut down your calories, the initial reaction of your body is to adapt to the circumstances. Okay, the body will not try to resist you. Okay, the human body will try to adapt to the circumstances, whenever and wherever possible, than to resist to the circumstances. Okay, so how does it adapts to, how will the human body adapt in the initial phases? It will reduce the metabolism. Okay, when the metabolism is reduced, naturally you will not have sufficient energy to do what you're supposed to do. Okay, so that's the physiological factor. So because of these two factors, in the initial phases you miss out. Okay, even if the person looks very energetic, he is working out, he or she is working out, doing everything, doing all the performances, you will never think that okay, they are suffering from some eating disorder. You will never, just by looking at them, looking at their performance, it will never come across your mind. Okay, so initial phases of eating disorders go unnoticed because of these two factors. So improve your body image. If you see on page number 220, there is a blue box. Okay, so this advice, or if you come across any person, any sports personality who may have, who may tend to have an eating disorder in their future, okay, you can give them the same advice given on this particular page number 220, blue box. Okay, so learn to for the first point is accept your body shape as it is, whatever may be your body shape, apple, pear, okay, square, rectangle, elongated, short, okay, whatever is your body shape given to you by through your genetics, accept that. And even though if in your eyes you may try to find some negatives, but try to focus on the good that you have. Okay, every body shape has its pros and cons, so focus on the pros rather than the cons. Fat loss will not solve any emotional crisis or any deep rooted issues. Okay, if you are body shamed or if you were body shamed since your childhood, etc., okay, it causes some emotional damage in your mind. Okay, you always associate beauty, health and wellness with a lean image. Okay, so even if you lose a lot of weight, you are not solving your emotional crisis that you have endured. Okay, so don't put a ban on food, don't count calories. Okay, because even if you if you start counting your calories just for fun, there are high chances that it may lead into an eating disorder. So avoid counting calories. Okay, that is the reason why in most of the nutrition classes and dietetics, when students ask that how much will be the calorie for 100 gram, how should I exactly take 100 grams, so I always advise just go by the portion size. Okay, what you know, how much portion will satisfy you. Okay, and we ourselves know that whatever we are taking, is it too much or is it too little, or is it enough for us. Okay, we have this intuition. You're not eating food for the first time, you are having morsels of food since the time you remember. Okay, so you know your body, how much you can have, how much is too much for you, how much is exactly adequate for you. Okay, so go by the portion size, don't count the calories. Okay, just control your portions. That is more than enough to achieve weight gain or weight loss, whatever is your personal targets. Okay, so there are many other points, important points given on that blue box. You can go through it, very simple points. Same advice you can pass on to others as well. Next, coming to female athlete triad. Okay, usually we will talk about menstrual issues as well as bone health issues. Okay, and if you see, the umbrella represents a healthy athlete. Okay, a healthy female athlete. Okay, she will have optimal energy based on her. A healthy female athlete will have an optimal energy based on her performance. Okay, eumenorrhea means a normal, healthy menstrual cycle without any issues. Okay, and then optimal bone health, her bone density, everything is fine. She's not suffering from osteoporosis or frequent small fractures, etc. So that's a healthy female athlete. But what happens when this healthy female athlete tries to cut down her calories? Okay, tries to cut down on her calorie intake. In short, she's putting herself into an energy deficient state. So slowly, when it comes to optimum energy, there is no optimum energy anymore. Okay, because there's a reduced calorie intake and low energy with either with or without eating disorder. Okay, it's not that every time you go on a diet it is an eating disorder. It's not like that. Okay, either it could be an eating disorder with low energy, or without any eating disorder, you are just in a state of low energy. Okay, then eumenorrhea, normal menstruation, subclinical menstrual dysfunction like dysmenorrhea will start. Excessive unbearable menstrual cramps. Okay, menstrual cramps are not like nowadays we consider it as it is normal, but usually menstrual cramps are not supposed to be normal. If you have a healthy periods, okay, if you have a healthy menstrual cycle, you should not suffer from menstrual cramps. Okay, menstrual cramps, when I say this word menstrual cramps, it is that unbearable pain that restricts you from performing your daily activities. Okay, for example, in case of school children, teenagers and all, and even for office going or working women as well, college going students as well, on the first day of their menstruation, it is so unbearable that they have to take half day leave and come back home. Okay, it happens. Or when they know that when they have got their periods, they take that day off because they can't bear it to go to work, they can't bear to go to school or college. Okay, so menstruation, a healthy menstruation is not supposed to ban your regular day-to-day activity. If the pain and the cramps are putting a full stop on your day-to-day activities, okay, you are just on your bed all day, you can't even lying, sleeping, whatever position you try, you're not getting the relief. Okay, that means there is something, some issues are are within you. You have to get yourself checked. Okay, it's not normal. Okay, so that is subclinical menstrual dysfunction. And amenorrhea is complete absence of menstruation. It starts with menstrual cramps and vomiting, nausea. Sometimes people may get fevers, chills, loose motions. Okay, along with all these things, this is still subclinical. Okay, after few months you will see no menstruation at all. Okay, that is amenorrhea. Okay, so that this is a female athlete triad. Okay, when we talk about bone health also, optimum bone health, optimum bone density, but because of uh, dysfunction in menstrual cycle, that will lead to low bone density. I'll show you why menstrual cycle and bone density is linked. We'll see that later. And it when your menstrual cycle is affected, okay, when your hormonal balances are affected, you will have low bone density. Okay, and finally it will lead to osteoporosis. So when we talk about female athlete triad, it has three main junctures. First is low energy with or without eating disorder. Okay, not every female athlete triad means that every person who is suffering from female athlete triad, they have an eating disorder. It's not compulsory. Okay, even without an eating disorder, a person may go into female athlete triad. Okay, amenorrhea and osteoporosis. So cessation of periods in people with eating disorder, that is amenorrhea. Okay, it mimics the onset of menopause. Okay, you will see the same symptoms of menopause in a person who has amenorrhea. So the symptoms are cognitive problems. Okay, their thinking issues, the way the thought process is affected. Difficulty in sleeping because of the night sweats and hot flashes. Mood changes, mood swings, extreme PMS, okay, night sweats and hot flashes. Like even if the temperature is, even in the winters, okay, even if it is the winter season going on, they can't put a blanket on top of them, or they can't even put a bed sheet on top of them. They may sometimes remove their clothes also just to get rid of the hot flashes that they're facing. Okay, that's because that's a symptom of menopause. And shrunken ovaries as well as uterus. So how menstrual dysfunction and bone loss is related. So low estrogen, when your cortisol levels are too high, your stress levels are too high because of energy deficiency, it will not allow your gonadotropin releasing hormones to release follicle stimulating hormone or LH luteinizing hormone. And when these two hormones are not released, it will also affect the release of estrogen as well as progesterone. That's the scientific medical part of it. So what happens here is basically when there is low estrogen, okay, there will be more bone breakdown. Okay, bone breakdown will be more because uh, your body requires calcium. Okay, your body requires calcium, and from there is no estrogen, the blood will go to the bones to dig up the calcium from the bones to supply itself. Okay, and there will be no enough bone building process that will be continuing, and that's when you get weaker and less dense bones. It's all because of low estrogen. So that's how menstrual dysfunction and bone loss are related. So does a healthy menstrual cycle affect your performance? Okay, do you can we say that, yeah, if you have a healthy menstrual cycle, you can perform better? Okay, it's true. It's very much true. You can see here, these are the different phases of a woman's menstrual cycle. Okay, follicular phase. Follicular phase is the phase when your egg is getting, your ovum is getting built up. Okay, the ovum is getting matured in the ovaries, in the follicles of the ovaries. Okay, since the ovum is inside the follicles of the ovary, okay, getting matured for its release, we call it follicular phase. Okay, and ovulatory phase is that 1 week time. It is just one day, but it is the we consider it as a week because based on the high chance of pregnancy. Okay, so ovulatory phase is the area when the ovum is mature, it is waiting to get released into the fallopian tube. Okay, that is the ovulatory phase. And luteal phase, if there is no no unprotected sex, and there was no sex at all. So what happens is that there is no sperm which is supposed to fertilize the ovum. So the ovum that has been released, it is still in the fallopian tube. Okay, it is still going towards the uterus. So and the follicles that has been left behind, the follicles which help your ovum to get mature. Okay, ovum has been released and it is gone, it is absorbed by your uterus. Okay, but the follicles which helped your ovum to mature, it is still remaining back in the ovary. Okay, so these follicles will uh, convert themselves into corpus luteum. Okay, and the corpus luteum will secrete the progesterone. Okay, so that is the reason why we get corpus luteum from follicles. So that is the reason why we name it the luteal phase, because corpus luteum has been formed. Okay, so you can see here, when in the follicular phase, both estrogen and progesterone are quite low. So do you see the performance levels here? It's performance levels, that is the blue lines. Okay, blue and the dark blue lines. The performance levels are also very low. Okay, when the estrogen and progesterone are low, the performance levels are also very low. As soon as the estrogen and progesterone rises, the performance levels also rises. Okay, so yes, we can definitely say the presence of estrogen and progesterone, the levels of estrogen and progesterone in a woman's menstrual cycle affects her sports performance. The absence of these two hormones, the absence of estrogen and progesterone in a female athlete will have a negative impact on her performance. Okay. So treatment, what treatment if you come across a female who is suffering from female athlete triad, what kind of treatment you can give? Okay, nutritional therapy and exercise revision is the uh, main treatment. And along with that, you have to refer her to a gynecologist. Okay, gynecologist has to be referred, and with their hormonal treatment, okay, hormonal HRT, hormonal replacement treatment and all, we can restart, we can initiate them into a healthy menstrual cycle, reinitiate them into a healthy menstrual cycle. Okay, so it's a multidisciplinary approach, usually given by a sports medicine provider, because in after, even after MBBS, you can become a sports medicine provider as well. You can get your MD in sports medicine as well. So it may include referrals to sports nutrition, adolescent gynecology, endocrinology. Okay, because when we are talking about the utilizing hormone, FSH hormones, it is secreted by your pituitary gland. Okay, so when the other glands are involved, your thyroid, pituitary glands, these are involved, you have to meet an endocrinologist. Okay, so treatment is tailored for each patient. It's not same for all patients. For different patients, you have different packages of treatment. Okay, and daily calcium as well as vitamin D intake will also be given. Next, coming to iron deficiency in athletes, in female athletes. So first of all, the first three stages of iron deficiency. The stage one, so your total iron resource in your body. Okay, the total iron resources what you have in your body. Can you say from which organs store the iron molecules in your body? Storage depletion in the chat box. It's your liver, spleen, and bone marrow. Okay, iron is stored in your liver, spleen, bone marrow. So when we talk about depletion, okay, the iron molecules which have been stored in these areas, it will be diminished. That is the stage one. Okay, nothing goes wrong with your blood, nothing goes wrong with your hemoglobin yet. In stage one, the storages which the iron store which your liver has, your spleen, and your bone marrow has, it is starting to decrease. Okay, there is no clinical symptoms outside. Okay, then stage two is iron deficiency anemia. Okay, this is where the new RBCs that has to be formed in your bone marrow, through your bone marrow, that will be reduced. Okay, then finally reduced RBC formation and secretion of RBCs in the blood along with the hemoglobin. So finally, the final stage is when you can say that your hemoglobin levels are less. Okay, you look pale, you look flushed out. Okay, so that is the stage three. So these are the initial three stages of iron deficiency anemia. Any doubts? Okay, so next coming to sports anemia. See, sports anemia, don't get just by the term itself, don't get confused that there will be iron deficiency here. Okay, there is no deficiency here. The athlete is having enough amount of iron. Okay, enough amount of iron is also getting absorbed. But what happens here is that, since because of the dynamics of the workout that the athlete has, okay, their cardiac output is quite high. Okay, the person who is going to regular gym, regularly working out, training and all, their cardiac output is high. When the cardiac output is high, the blood is in a diluted form. Okay, there is a lot of water in the blood, hydration is too much in the blood. Okay, so what happens here is that your RBCs, they get diluted a lot in your too much of vasodilated blood. Okay, so that's what gives you sports anemia. Okay, it's not a true anemia. It's not because of iron deficiency. Okay, it's not because of you have less RBCs. Okay, it's you have enough amount of RBCs being produced by your bone marrow. You have enough amount of RBCs in your blood circulation, but your blood volume is too much. Your plasma volume is too much. You have too much of water content in your blood, and that gives RBCs a diluted functionality. Okay, and also a lot of RBCs undergo lysis because of the amount of stress that is given during the workout. Okay, so that is sports anemia. It's the another name is dilutional pseudoanemia. Okay, dilutional pseudoanemia. It's not true anemia. Pseudo means it's not true. Okay. So why are iron deficiency and anemia more common in female athletes? Okay, reason being, first is your blood loss during menstruation, in the growing phase. Okay, too much your iron levels comes down, and if you're not replenishing your iron levels on time, that could lead to anemia. Okay, due to menstruation. And athletes who are already dieting and restricting themselves with calories, those who are vegetarians and vegans, okay, they are at higher risk of getting anemia. Others, the endurance athletes and endurance female athletes like distance runners, sprinters, okay, and because of their, as I mentioned earlier, the amount of pressure that the tissues have, the muscles put on the vital organs, okay, they can all, in some cases, they will also have hematuresis, okay, in which there's loss of blood through urine, okay, too much of exhaustion of your body, it could lead to intestinal bleeding, bleeding in the kidneys, okay, these could lead to blood in the feces, blood in the urine, okay, that's also the way how female athletes can get anemia. Okay, then iron supplements and their impact on performance. Okay, so aerobic training, iron supplementation and their combination all are a result in significant improvements in several measures of the maximal exercise performance. For example, the statement may sound very complicated. The main thing is, if you have RBC, okay, if you have RBC, you will have hemoglobin. If you have hemoglobin, you will have oxygen reaching your tissues. Okay, if you do not have RBCs because of your iron deficiency, you will not have enough hemoglobin, you will not have enough oxygen reaching the tissues. Whatever you eat, but if oxygen cannot reach to your tissues, how will you get energy? Okay, how will you get the impact of your impact of power? Okay, so iron supplementation and along with aerobic training makes sure that you have enough endurance in your muscles with the help of aerobic training. But along with that, iron supplementation will counteract any iron deficiencies. It will not allow the RBCs to go down. Okay, it will not allow the hemoglobin to go down, and you will still have a continuous supply of oxygen. Okay, when you have a good aerobic training and this continuous supply of oxygen, okay, it will give you a maximum exercise performance. Okay, so iron is especially important for athletes who especially who have an increased demands on their muscles during training, especially those who are doing aerobic exercise, sprinting, okay, runners, swimmers, etc. Okay, those who require a lot of energy in their muscles, okay, for the power of impact of power, for them iron supplements is required. But it doesn't mean that iron supplements will enhance your performance. Okay, it will just rule out the cases of deficiency. Okay. Next, coming to pregnancy and female athlete. So obviously there is a whole lot of physiological change that happens in a woman's body during pregnancy. Same will happen for a female athlete as well. So changes in the athlete's body during pregnancy can increase the risk of overheating, dehydration and low blood sugar. If she's not keeping up her pregnancy demands with her training, okay, she may suffer from all these symptoms. Okay, so pregnancy can also make some problems worse in athletes, such as loss of bone density, anemia, pelvic floor dysfunction, because during pregnancy, in your all three trimesters, you have to start doing Kegel exercise. Okay, Kegel exercise will make sure that your pelvic floor, the perineal area, pelvic floor, the muscles get tighter and stronger. Okay, so that you can endure the labor pain. Okay, without much complications. Okay, so if you are not focused on your pelvic floor strengthening and you are focused on other body part strengthening, you forget about the pelvic floor strengthening during the pregnancy time, it may lead to some dysfunction during labor. Okay, then urinary incontinence, different musculoskeletal problems along with the existing, all the athletes have already have some musculoskeletal problems before, because of their training. On top of that, pregnancy induces more such problems. Okay, now coming to body fat and fertility. So for a healthy woman to get conce- uh, conceived in a normal condition, she should have at least 22 to 25% of body fat. Okay, how do you find 22 to 25% of body fat? You can go for a DEXA scan. Okay, your muscle, the muscle percentage, your lean mass, your fat mass, your bone density. Okay, everything you will get a snapshot of. All the information will get a snapshot of it using a DEXA scan. Okay, so in the results, you should have at least 22 to 25% of body fat to go through a healthy conception. Okay, so those athletes, most of the female athletes, they have a body fat count that is very low as 8 or 10, especially in an appearance focused sports like ballet, gymnasium, etc. Okay, if you check the body fat level of those sports elite sports personalities, you will see that body fat count is less than 10%. Okay, so it will be quite difficult for them to conceive. Okay, because you require body fat, because your body fat, your lipids, okay, your body fat will help you to produce hormones. Okay, when there is an absence of body fat, the amount of hormones produced is also in a very decreased ratio. Okay, so you have to overcome that. Okay, for if you're planning for conceiving, you have to increase your body fat percentage. Okay, so the normal body fat percentage required to maintain a normal BMI or for fertility, that is about 20 to 25 BMI you have to maintain. If you go over that also, it will be difficult. You may go into a complicated pregnancy. Okay, overweight issues will lead to complicated pregnancies. So what is a good average weight gain during pregnancy for a healthy individual who is not too thin, who is not malnourished, who is not undernourished? Okay, for a healthy average athlete or individual, 10 to 12.5 kgs over 40 weeks of your gestational period. Gestational period is the entire period when you are pregnant, from the first week of pregnancy uh, to the labor day. Okay, that is your gestational period. Okay, 40 weeks, an average of 40 weeks. Okay, so during over 40 weeks, you should have gained at least 10 to 12.5 kgs. That is a healthy weight gain, recommended weight gain. Okay, women who are thinner, who you before getting pregnant or during the first month of pregnancy, they are malnourished or undernourished. Okay, thinner women. Okay, for them it is recommended to gain at least 12 to 18 kgs. Okay, so by second trimester and all, you don't have to focus much on calories. What you are having as a non-pregnant woman, focus on the same amount of calories with more being more indulgent in protein, calcium, and for iron and folic acid. Okay, that's it. But when you reach your third trimester, that is the seventh, eighth, and ninth month of pregnancy, you have to take an extra 200 kilocalories to keep up with the fetal growth. Okay, to keep up with the child's growth. Next, coming to general nutritional guidelines, what you can recommend to others who are pregnant, athletes who are pregnant, make sure they have enough amount of omega-3 and recommended amount of omega-3 and omega-6 fatty acids. If they are taking multivitamin tablets and minerals, is well and good. If they're not eating much fresh fruits or vegetables, write them up for multivitamin tablets and minerals. Folic acid, definitely it will be given free of cost from primary healthcare centers as well. Okay, avoid alcohols, avoid any substance abuse, smoking, or any drugs. Okay, avoid eating raw eggs or unpasteurized milk because you do not want to contract any salmonella typhi or any salmonella infections. Okay, and even when you are eating some cheese and all, like the mold ripe cheese and all, that is the blue cheese, okay, which has this fungi already present on it. Okay, that fungi gives gives this cheese a distinct taste and all, so avoid eating such food. Okay, so all the other general guidelines, nutritional guidelines are mentioned on page number 229. Just go through that. Okay, simple ones. Any doubts here, please mention the chat box.